can we blame advertising for this? And recall that we saw that the world is getting more obese. So for example, the United Kingdom, where advertising on food has continually decreased over the last 2 decades, but still the United Kingdom is getting fatter. The Middle East is getting fatter, and it's not because they're advertising Happy Meals on Al Jazeera. You know, well, children are getting more obese, but it's not because, is it really because they're seeing the advertising? Children can't drive to the supermarket. Parents still dictate their children's eating habits. And in fact, children are actually seeing less advertising than they did, say, in my childhood, because instead of watching TV, kids are on the internet, they're playing video games, they're watching DVDs, they're seeing fewer ads. And as I've noted, it's an international problem, and we can tell that it's not just advertising because our pets are getting fatter too. I'm pretty much out of time here, so I'll stop there. But in sum, what I want to suggest is that we have a public policy problem here, but you know, focusing on the advertising, trying to blame the vendors of food rather than the social changes that have caused us to gain weight is not an effective solution. And in particular, class action litigation is a very poor Procrustean approach to solving this problem, as the courts have so far found. Thank you.
Apologies, I've got a bit of laryngitis, so I'm thankful that there's a microphone. So I focused my presentation actually in a couple of different areas. I didn't take such a broad approach, but in fact focused very specifically because this is a law audience. I am emphasizing some of the public health side of the obesity epidemic, assuming that you have less familiarity with that. And I really focused in on this example of taxation on sugar-sweetened beverages. But certainly it can be applied more broadly. So what I'm going to talk about here is this idea of taxation as a disincentive for overconsumption. And this really falls under a broader umbrella of what we'll refer to here as public health regulation or public health policy. And like I said, I focus on sugar-sweetened beverages simply for simplicity. This is a very complex issue, as Mr. Frank has outlined, and it is quite complicated, so for simplicity's sake, I'm just focusing in on this one element. But as we continue to talk, we can broaden it to other issues. So what I thought I would do is actually walk through what one person, Larry Gostin, has outlined as criteria for making a determination of when public health regulation is appropriate, and I'll try and make a case here for the taxation of sugar-sweetened beverages as a means to reduce obesity. So I've outlined here the 5 criteria that Gostin outlined that are essentially, this is what we do to judge whether or not it's appropriate to be regulating behavior that pertains to public health. So first we need to demonstrate that there is a risk that's taking place. We need to demonstrate that there's some amount of effectiveness in the intervention that we're proposing. In this case, my intervention would be a tax on sugar-sweetened beverages. Then we have to take into account what are the economic costs of this intervention, what is the burden on individual citizens, and then assess the fairness of the policy. So we're going to walk through this right now using this as an example. So I think Gostin, who's incidentally a lawyer, and prepared a great public health law series back in 2000 in the Journal of American Medical Association. I think he did a very nice job of outlining how we can use information to judge whether or not public health is warrants regulation. So in terms of demonstrating risk, obviously we just talked a little bit about obesity, but I would actually argue that obesity isn't just the result of individual behavior, but it's in fact influenced by environmental, social, and cultural factors. There is a role for genetics to play, but I'll argue that that's actually fairly minimal. And the consumption of sugar-sweetened beverages have been established to contribute to weight gain and particularly obesity in both kids and adults. So as we look over time, we can look at sugar-sweetened beverage use, and we've separated this out by kids and adults. You can see that generally the trend is on the rise, although these data end in 2006 where there seems to be a bit of a dip. But certainly if you look at the trend in adults, it's quite alarming to see the degree to which sugar-sweetened beverage use has increased over the years. So I'm going to walk through just a background to give you a sense of the trend in obesity in the US. So these are data on obesity specifically. So this is assessed by body mass index, which in this case is about 30 pounds overweight for a person of 5'4". And these data are from the behavioral risk factor surveillance system. So these data started being collected in 1985. The white spaces are states that didn't have reporting data, and you'll see as we march through time we have complete data. But the lightest blue represent a prevalence of obesity of less than 10%, and the darker blue represents 10 to 14%. So as we march forward through time, each one of these slides increases a year's worth of data. We see that not only more states are coming online, but we see more states with a high prevalence of 10 to 14% of their population. So this is 1988. As we march forward, by the time we get here to 1991, we enter a new category, the darker blue, which is 15 to 19% of the population. We continue to move forward. By 1994, we have complete data from all states reporting, and the highest prevalence that we've detected in 1994 is 15 to 19%. We keep moving forward. Now we've got 20 to 24% coming online with the light yellow. We continue to move forward. By 2001, we've got one state that has 25 to 29%. Again, moving forward in time, you can see the pattern shifting. We've got 25 to 29% in several states. And by the time we move forward to our current data in 2009, we have numerous states that have over 30% of their population at a level of obesity. This is not overweight, this is obesity. So the argument here is that in the past 30 years, our genetics probably haven't dramatically changed. So this argues for the fact that there are several other factors that are contributing to obesity, and genetics isn't the big, it's a role, it has its role to play, but I don't think our genetics changed that dramatically in the past 30 years. So we've got this very severe rate of obesity in the US, and in fact 2/3 of Americans are considered to be the overweight category, which is the majority of us. And we see it that from that trend line that I showed you earlier, that sugar-sweetened beverages have actually increased quite dramatically over this corresponding period. And in fact, from data from 1970 to 97, the annual intake went from 22 gallons, which is a fairly horrifying number. This is just for soft drinks, to 41 gallons in 97. I'm sure it's higher now. And we do know that there's actually an association between the increased caloric intake that you get from sugar-sweetened beverages, and that's correlated with an increase in weight. So this has been demonstrated in cross-sectional studies as well as experimental studies and longitudinal studies, and it's been evaluated in several reviews and deemed to be a moderate contributor to excess weight or body mass index. So that is our summary of what we see. There is an association between these two things. So moving on to whether or not, so would some kind of a policy type of intervention be effective to address this problem in our culture? And so there have been several studies that have actually looked at whether or not whether changes in pricing influence people's behavior. So there was a randomized trial that was done, giving people a fixed budget. I think it was a fixed amount of $22.50 for a grocery store trip, and they had to make decisions about food, and the pricing was manipulated. And what they found in this experiment was that increased pricing actually promoted healthier choices. In contrast to making subsidies, making healthier food less expensive actually did not encourage people to make healthier choices. So this helps to make a case for the fact that people are more responsive to the increase in price than they are to price reductions. In a different type of intervention that was done in a hospital setting using a similar hospital for comparison, they manipulated the price of sugar-sweetened beverages, and actually saw when they increased the price of sugar-sweetened beverages, they saw a 26% decline in consumption in this hospital. This is a real-world setting. This is real people making their decisions on medication. So what has been concluded, looking at the, quite a bit of research on sugar-sweetened beverages, has found that it's non-trivial tax increases that are associated with a reduction in consumption. And the economists have estimated that the price elasticity is -0.8 to -1, which is essentially assuming that you don't substitute one sugar-sweetened beverage for something else by increasing the price on one, you go to some other type of sugary beverage. Assuming that you don't have that type of substitution, that an increase of a 10% type of tax would actually be associated with a reduction in consumption by 8 to 10%. And that translates into roughly 0.2 to a pound annually, which is not a meaningless amount given the high degree of weight gain over time. So these factors help to make an argument for the fact that if we do change tax, that it changes price on these particular items, we would likely see a change in purchasing behavior. So then we have to move move on to looking at the economic factors. So we've talked about the fact that the prevalence of obesity is at an alarmingly high level. The obesity attributed costs are estimated to be over $75 billion a year, and half of that is paid by Medicare and Medicaid. So this is a problem for our government, whether we like to acknowledge it or not, because we're paying these bills. So some have argued that this circumstance, in particular for not just sugar sweetened beverages, but junk food or other foods in general, we're in a market failure situation as defined by when there's a warrant for doing a regulation. And that this argument has been made on the idea that consumption decisions are made with imperfect information. How many of you saw the movie Super Size Me? Okay, so you may recall there was a small part of this movie in the documentary where Morgan Spurlock went around and asked people, what's a calorie? And people's responses were across the board wrong. I'm sure he edited out the good ones, the people that got it right. But the concept was not clear to the general public, and I'm sure it's generally a confusing topic for even those that are fairly well informed. And my favorite anecdotal response was, something you're not supposed to have? This is what a calorie is. So people do not understand this concept of how they're making decisions about food. So people have imperfect information. And oftentimes people will choose the short-term gratification over a long-term sort of harm. I want this soda or I want this item right now, and I don't care what happens later. I don't care about the consequences. And then lastly, the consumers actually only bear a portion of the burden because some of these costs are actually attributed into healthcare costs, which we don't pay generally directly. We pay a portion of them. So as people make these decisions, they actually don't have to bear a consequence of their decision entirely. So this is what the argument has been made for regulation being warranted from an economic standpoint because we've had a market failure. When we're looking at the burden on individuals, the idea, again, looking at an excise tax on sugar-sweetened beverages, it would likely be applied at a wholesaler level. And so generally what happens, as in the tobacco industry examples that have already been mentioned, that cost increase would be passed on directly to consumers. And so therefore the regulation that, of this type of regulation would actually just affect pricing. It wouldn't make any restrictions on what's available in the marketplace based on caloric content. Although some have made that argument. But if you're looking at taxation on products, it doesn't restrict marketing, which isn't actually an infringement on personal freedoms, it's just a price adjustment. So last criteria would be the assessment of fairness in the policy. So I've tried to make a case that sugar-sweetened beverages have a demonstrated relationship with obesity, and what I didn't mention is there isn't actually any other nutrient value to this particular example. Other beverages and other foods are less clear-cut because there are good health benefiting elements to all foods, and so it makes for a more difficult argument when you're talking about what's a good food versus a not good food, and we can maybe talk about that in our discussion. But certainly, one of the things when you're assessing fairness of a policy, a lot of people argue that a policy where you're considering taxation, that there's an element where the lowest income individuals would be the most hard hit. And what's interesting, one thing to consider is that obesity isn't just a problem of our lowest income individuals. Most recent data show that the gap between obesity rates by income level is almost gone. So we have obesity at all income levels. So this is a problem of our entire society. And what we do know is that although the price does influence people's behavior, it's not a huge contributing factor to people's grocery bills. It plays a role in people's dining habits, but it doesn't necessarily shift the overall household grocery budgets in the same way that when you talk about the regressivity issue when you're talking about tobacco use, that the high cost and the addictive nature of that product actually becomes much more of a dominant issue because people do have to account a large portion of their budget to purchasing tobacco. So, but that's not quite the same case here. So what I would say is that when we take all of these, the criteria that Gostin lined out for us, we have to evaluate whether or not public health intervention in the form of regulation is worth it. And so what I've tried to argue here is that obesity is a severe yet a preventable health cost that we bear on our society, and that sugar-sweetened beverages, as well as junk food, make a contribution to American obesity, although it's only a small contribution. And it is an input-output model that excess input and insufficient exercise or balance to that equation will increase your overall weight. So that is in fact a problem, but sugar-sweetened beverages and junk food only contribute to a portion of that. When you look at what has been proposed by a lot of folks in public health, they recommend